there is specific advice for healthcare professionals on what they should do as regards the VALPROATE pregnancy prevention programme, and in particular the sort of counselling and materials that should be given to these women. The pharmacy department at the Royal Cornwall Hospital looked at what we could do to support what is mainly sort of primary care actions around making these materials available, other than of course the specialist annual assessment. And we introduced a policy in January 20 that asked our pharmacists to speak with women that were inpatients in our hospital, women of childbearing age who were receiving VALPROATE, and to have a discussion and make available to them the materials promoted by the MHRA. We have an electronic prescribing system, so we were quite easily able to identify those women. So this was introduced in January, and then when we looked between January and July 2020 to see what had gone on, we noted that there were 17 women that were in the hospital during that time, and of those 17, although they'd all had medicines reconciliation at admission and therefore been in contact or had been spoken to by members of the pharmacy team, there was only one instance of a record on our EPMA system of such a PPP discussion having taken place. As a result of that, we had a discussion with our pharmacy team about how we can improve the situation, and the suggestions were made, first of all, making the policy, making them more aware of the policy, then introducing a live electronic prompt that pharmacists get to see each day that again identifies those women that are on the wards and receiving VALPROATE, and also a surveillance report that prompts three senior members of the pharmacy team to again reinforce to the pharmacists that are responsible for those wards that they need to go and speak to women that are inpatients, women of childbearing age receiving VALPROATE. So in phase 2, between mid-August to October, there were 13 females on VALPROATE. They'd all, again, had medicines reconciliation at admission. And in this time, there were 10 instances of a record of EPMA, a record on EPMA of that discussion having occurred. So that's quite a dramatic improvement. However, what we found was that of those 10 instances, only 6 notes had been made on the system in such a way that they would transfer to the GP at discharge or to the community pharmacy as part of a transfer of care around medicine service.